All right, so today's discussion is on chapter 35, which talks about cosmetic dentistry and teeth whitening and starts on page 807 of your textbook. We're going to explain the role of the dental assistant in cosmetic dentistry with this discussion, as well as the scope of cosmetic dentistry. We'll discuss the basic elements of psychology and sociology that are considered for cosmetic treatment and what the patient should consider when selecting a dentist for cosmetic treatment. We'll identify and describe specific procedures performed in cosmetic dentistry, including diagnosis and treatment planning, legal forms, and documentation. We'll talk about the role that oral photography has in cosmetic dentistry and describe why soft tissue surgery may be needed sometimes. We'll also explain why the dental team needs to know about occlusion, and we'll describe the types of restorations that are placed, as well as the materials used in cosmetic restorations. Lastly, we'll talk about the marketing techniques for cosmetic dentistry. So many of the procedures performed in cosmetic dentistry are performed by the general dentist or prosthodontist. The American Academy of Cosmetic Dentistry offers training and continuing education related to cosmetic dentistry procedures and techniques. The staff in cosmetic dentistry is similar to the staff in the general dental office. The chairside assistant in the cosmetic dental office may perform many advanced functions if within the state practice requirements and if he or she is properly trained. The types of procedures that fall under the realm of cosmetic dentistry are very broad and include placement of bridges and crowns, veneers, tooth whitening, straightening of teeth, lengthening of the teeth, recontouring of gingival tissues, correcting bites, closing gaps, repairing chips and fractures, replacing missing teeth, and dentures. Some procedures may require a specialist in a particular area of dentistry to complete the work. The goal of cosmetic dentistry procedures is to improve the look and appearance of one's teeth and oral structures, as well as to correct and restore function. When choosing shades for the restored teeth, it is important to make the decision in natural lighting. Also, when matching colors, it is important to consider the three parameters of color: hue, chroma, and value. Hue is the name of the color, chroma is intensity or quality of the hue, value is a brightness of the shade of the tooth, and opacity and trans opacity and translucency must also be considered when matching tooth colors. Opaque materials reflect light, while translucent materials allow light to pass through. Illusion is the art of making something appear differently than it actually is. Teeth can be made to look different sizes and shapes through the process of illusion and coloring and shading of the teeth. The shape and form of teeth also need to be matched. Gender and environmental factors can also play a role in the way teeth look. So, what is a term that describes the intensity or quality of the hue? We talked about that. That was chroma. It is important for anyone involved in the cosmetic dental procedures to understand how the patient feels about his or her appearance and the motivation behind the procedure. Psychological factors include learning the patient's personality, desires, and expectations. It is important for the patient to feel that the dental staff has care and concern for him or herself and the procedure. Sociological influences may play a role in an individual's desire to seek cosmetic dentistry solutions. The media, television, and advertising set standards for what is deemed acceptable and attractive in society. It's important for the patient to find a dentist who is trained and proficient in the procedures he or she is seeking to have. The patient may seek referrals from a general dentist, and they may call and inquire about the credentials of the dentist or dental specialist he or she is researching. Availability of the appointments is also a factor that must be considered. Many cosmetic dental procedures require multiple visits and must be able to accommodate the patient's schedule. The first steps toward treatment is a complete evaluation and history. The dentist must understand the patient's needs and goals. An evaluation must be made of the problem, and a complete assessment of the options must be determined. The dentist may clearly state what the expected outcomes of the options may be to the patient, and x-rays, photographs, study models, and charting may all be used to thoroughly evaluate the needs and requirements of the patient and the treatment plans. Once a plan has been determined and agreed upon by the patient must sign legal documentation agreeing to the procedures. This acknowledges that the patient has been informed of the plan, is aware of the potential outcomes or complications of the plan, and agrees to the plan. Oral photography is a skill that is required by most cosmetic dentists. Photographs can be taken to assess and evaluate the patient history and presentation. Study of the photographs can help determine the course of action that is most suitable for correcting the issues presented. Photographs also present a means for the dental office and the lab to communicate and to have a frame of reference when creating appliances or prosthesis for patients. Insurance plans increase acceptance of claims when photographs accompany the treatment plan. So photographs can be magnified to see finer details, which aids in quality control and implementation of appliances and treatment plans. Photographs also make great marketing material, allowing the dentist to present a before and after to show future patients the potential results of treatment. Some equipment may range from a 35 millimeter camera and digital cameras to small intraoral cameras. Extraoral photography usually consists of a full face and profile view of the patient. Intraoral photography consists of all the various views inside the oral cavity, such as anterior, the maxillary, the mandibular, the buccal, and lingual views. These may need the need of these may need the aid of mirrors and retractors to acquire a shot that is usable and helpful. The appearance of the gingival tissues is as important as the tooth structures themselves when improving one's smile and dental functioning. Some people may have excessive or inflamed gingival tissues, among other conditions that can be improved by contouring of the soft tissues. Electrosurgery units and lasers are the most common methods to do this contouring, as the precision is great and there is less tissue trauma as a result. Aesthetic crown lengthening is indicated to establish the proper relation of the gingival margin with the lip and to increase the length of the teeth for appearance and prosthetic crown retention. So if a patient has teeth that appear shorter than normal, what procedure might that patient consider? We just spoke about this, and that's crown lengthening. So crown lengthening is a procedure done where gum tissue and bone that supports the tooth is removed so that the crown, or the portion of the tooth that we see in the mouth, appears lengthened. Another common reason for cosmetic dentistry is to improve one's bite, which may improve the overall look of the patient's smile and the function of the mouth. In general, and often, there are skeletal, dental, and muscular problems that are associated with a malocclusion or bad bite. An orthodontist may be the specialist that is seen to make these types of cosmetic changes. There are a wide variety of restorative materials that are used in cosmetic dentistry that are being improved upon regularly. Many of these materials have been discussed in a previous chapter, such as composite resin, ceramo-metal restorations, and porcelain restorations. And here's a before and after kind of example of someone that's had a type of cosmetic procedures that are done. This patient on the left has teeth that appear healthy. However, they have a type of staining known as tetracycline staining that make their teeth look orange, grayish and orange. And you can see after they have had porcelain crowns placed on top, their smile looks much more aesthetic and much more visually pleasing. Just like any other service, marketing is crucial to the success of the cosmetic dental office. For most people, cosmetic dentistry is something that is done if there is extra money that can be spent on making such changes. It is not part of a routine dental care, and most procedures are not covered by insurance. The practice must clearly outline its goals and commit to trying a technique for a specific period of time to evaluate its effectiveness in attracting patients to the business. Tooth whitening is a procedure where the restorations of teeth of a tooth surface um, appears more white by removing dirt and debris. With bleaching, teeth are being whitened beyond their natural tooth color, and most teeth whitening shade guides are handheld displays of tooth shades. The standard guide usually includes 16 shades progressing from light to dark, and shades may vary depending on the age of the patient and on the properties of their teeth. Just a reminder, natural light should be used when selecting the preferred shade of whitening. One of the most requested cosmetic procedures is tooth whitening. This is an expanded function for the dental assistant and requires additional training if allowed to perform these functions in the state of practice. There are a variety of agents that can be used to whiten or lighten the teeth. Hydrogen peroxide interacts with pigments on the teeth, causing a whitening effect. Carbamide peroxide works in a similar manner to hydrogen peroxide, but it's weaker and must be thickened to allow a prolonged exposure to whitening agents. Sodium perborate is mixed with hydrogen peroxide to help whiten non-vital teeth or teeth that have been root canaled. The most common tooth whitening shade guide is the VitaPan Classic Shade Guide. It has 16 shades, and they are all pretty much white with varying degrees of grays, yellows, or orange. And you have to remember to use natural light when choosing a shade. There are a variety of causes for stains on the teeth. The sources are generally either extrinsic or intrinsic. Extrinsic stains come from a diet of bad habits such as drinking tea or coffee or smoking, which all cause discoloration of the teeth. Intrinsic stains are due to internal processes such as medication use, injury, or other dental procedures. The role of the dental assistant includes someone that can provide info and answer questions. We'll assist chairside for treatments. We'll instruct on how to use home whitening procedures or preparations. We'll fabricate custom trays and we'll obtain consent forms. Whitening of the teeth can be accomplished in the office or at home and over-the-counter products. The effectiveness and extent of the whitening is achieved is variable based upon the treatment chosen and the extent of the discoloration. When restorative materials are used to fill teeth or the root canal, these teeth may attain a darker appearance due to the materials used. These teeth can be lightened with bleaching techniques, and it's usually accomplished in the dental office. In-office bleaching uses liquids or gels and a curing light to achieve results. This usually takes 3 appointments and may cause sensitivity in the teeth until the procedures are complete. Home bleaching can also be used, and these products are not as potent and take longer to achieve the results, but they are less expensive. There are a variety of OTC products a patient can use. It is important for the patient to let the dentist or dental assistant know if he or she is using whitening products at home. This is everything I have for chapter 35. Please let me know if you have any questions. Thanks for watching.